Hi everyone, welcome back to my channel. This is Josie's Point of View, and today we're focusing on veterans healthcare. But before I begin, I want to say a special thank you to my new subscribers. I want to say welcome, and I appreciate the fact that you've taken the time to just review our videos, and I want to encourage you to leave comments and let me know how you feel about the topics being addressed. Our story today takes us to the nation's capital, Washington, D.C. Take a look at the headline. And it reads, VA doctor said veteran could go kill himself, and he did. I'll provide you with a summary here, and I'll place a link to a few of the full articles in the description box. So today we're talking about the VA hospital in Washington, D.C. This hospital has been around since the late 1960s, and it holds a lot of significance to me because I can remember during the early 1980s when I was in college and I had to work in the evening. I would be on the bus and there was a stop by the VA hospital. The hospital wasn't as big as it is right now, but the bus would stop there because we didn't have the subways at the time. And it was always exciting to see all those professional people walking in and out and the patients standing around outside. And in my mind at that time, I kind of wondered whether I could ever become a professional and be able to become part of that organization. But a lot has happened over the years, and the hospital it has been in the news lately, and that takes us to the story for today. So I want to share with you the facts of a case based on a recently released VA Inspector General's report. And as you can see, the date is 7/28 July 2020. And this is all in the public domain, so there's no confidentiality issue here. So I'll put the link there. And if you were to click on the link, you'll come up to this page. And if you wanted to see the entire report, you just click on Download Report and you'll be able to have access to the entire Adobe file. But reporters have written about this, but I want to go back and look at it myself and tell you exactly what was in that report. So I want to give you a summary of the case, and then I want to tell you exactly what the VA Inspector General concluded. So the case is about a veteran, I wouldn't say elderly, I would say middle-aged veteran who had some chronic health issues and some pain management issues. As a result, he became dependent on pain medication to the point where he needed to detox. And he was trying to do this as an outpatient, and it really was not working for him. So one of his provider had written in his record that in his particular case, he was most suited to detox as an inpatient. Well, anyway, on this particular day, the pain was pretty bad, so he called and spoke to a nurse on the phone, and then based on their conversation, he agreed to go to the emergency room the following day. So the veteran and his family member went to the ER, the emergency room, the following day and told them he was having withdrawal symptoms, and he asked to be hospitalized in order to be able to detox. He saw a physician, and then he saw a social worker who scheduled him for a same-day psychiatric evaluation. The key here is that they did not do anything for him, and he didn't get what he wanted, which was to be admitted for detox. So the veteran and his family went to the patient representative, or they now call them the veteran experienced person, but this is the person you go to and complain if you're not happy. So he went to this individual and told him he was not happy with what had happened in the ER, and again he requested to be admitted to the hospital in order to detox. So after taking his complaint, the veteran experienced person accompanied the veteran and his family back to the ER staff and told them again that of the veteran's preference to be admitted in order to detox. And it's not really clear what the response was because the veteran and his family went ahead to that same day psychiatric appointment. And after meeting with that psychiatrist, the psychiatrist determined that the veteran had a moderate risk for suicide and wrote in his note with an alert to the ER physician that the veteran should be admitted for detox. He then escorted the veteran back to the emergency room and handed him off to the emergency room personnel after giving them a verbal report. I'm sure by now it was much later in the day because things doesn't happen very quickly at the VA. It all takes a while. And at that point, the family member had left and went home because it was the expectation that the veteran would be admitted to the hospital. So then a physician assistant wrote in the note that the veteran was to be admitted to inpatient psychiatry, and he went ahead and paged the psychiatric resident for an admission evaluation. When the resident came, he assessed the veteran's suicide risk as mild and wrote that the veteran did not have any safety concern. So this psychiatric resident recommended that the veteran be discharged to home. And the discharge instruction simply said he needed to follow up with mental health. It did not say when, or it did not say if he was supposed to see someone specific in mental health. It did not say if he was to walk in or if he had a scheduled appointment. But keep in mind that after all this had transpired, no one had yet addressed the veteran's problem, which was his pain issue and his need to detox. Well, after all this time, when the veteran found out he was being discharged to home, I'm sure he had a fit. He was upset. I'm sure he was loud. I'm sure he used a few choice words. But another physician in the ER, we'll call him physician number two, he contacted VA police and had them escort the veteran out of the building. So they took him out, but after they took him out, the veteran still called back and spoke to his staff and let them know, look, my pain issue had not been addressed. He still needed meds, and he told him that he was going to come back into the ER. So when that information was relayed to physician number two, he said, I don't care. Tell him he can go kill himself. And that was his last encounter. So the veteran called his family, they picked him up, and he went home. No one followed up. He had absolutely no contact with anyone at the VA, and 6 days later, that veteran killed himself. The Inspector General concluded that several people failed that veteran. He saw 7 providers within the 12 hours he spent trying to get treatment. No one was really ready to, they weren't reading the notes, they weren't collaborating with each other, and they discharged the veteran without doing anything for him and without even understanding his withdrawal symptoms, which included seizures and the fact that he was out of medication, which would cause him to have additional symptoms. The IG said they failed to assess his vital signs and used their own personal views to make decisions rather than making decisions based on what was actually taking place with the veterans. They also failed to appropriately address his risk for suicide. And when follow-up treatment plans for the veteran were written in his notes a few days later after this incident, nobody bothered to contact the veteran and let him know, yet they went ahead and canceled those plans when he did not show up. And I know for a fact that does happen because, especially in mental health, you will have an appointment, they will cancel the appointment and reschedule it, but nobody tells you, and when you don't show up, it's being held against you. The Inspector General also concluded that the staff did not carry out the orders written by the outpatient psychiatrist, and further, the staff failed to follow VA policy by reporting other employees for misconduct. And the misconduct we're talking about in this case is the behavior of physician number 2 and his irresponsible comment that the veteran should go kill himself. Even though several people heard it, they did not report it, and that physician was not even a VA employee. He was a contract physician, and he had a history of verbally abusing, hospital employee. And they should have reported that to the contracting agency who employed him, but nothing was done. But this bad behavior continued, and it was only after he verbally abused another hospital employee later on that they took steps to terminate his employment. So right now, that physician number 2 is probably out there at another hospital still engaging in this type of inappropriate behavior. And what do I think about all this? Well, I think it's tragic. It's heartbreaking. It's deplorable. It's inexcusable. If you don't want to work with veterans, then don't work. Then don't come to a veterans hospital. But if you're working in a hospital, we are expecting you to provide us with care. But what I know is that this type of response to veterans seeking care should never be tolerated. All they had to do was read the notes in his record and understand why the veteran was asking to be hospitalized to detox. But no, they tossed him around like a rag and sent him away to the point of having the VA police physically remove him from the emergency room. You toss him out with no meds, and you don't even address his pain problem. I wonder if the rest of the world really understand the hell that we as veterans has to go through just trying to get some type of health care. This man had nowhere else to turn and he killed himself. Personally, I just find well, I'm just tired of hearing administrators say this is just an isolated incident. No, it's not isolated. It's happening more than people realize. And it's a reflection of what you're doing every day, because for every one case that finally gets spotlighted in the media, there's probably a dozen others really that's covered up. Maybe if some of these administrators had to face a different consequence for treating for the way they treat veterans, maybe if they had to face disciplinary measures for every veteran who died in this manner, maybe then the standard of care would eventually improve. I'm a little bit exhausted, but that's all I have for you right now. Please feel free to leave me a comment and let me know what you think about this video. And feel free to share this video. And if you haven't done so already, I want to invite you to subscribe to my channel by clicking on that red subscribe button on the bottom right-hand corner of your screen. And if you click on this notification bell right here, you'll be the first to know whenever a new video is uploaded. I thank you for watching, and I'll talk to you soon. Bye.